Making decisions. In life, we are all faced with having to make decisions. For people with diabetes, this can be very challenging because we have to make these decisions when our health is uncertain. Developing good decision-making skills is another self-management tool. Let's look at some steps to help us make decisions, and then we'll see an example before we practice. Decision-making steps. Identify the options. For example, someone is trying to decide whether or not to start a new medication or whether to take a trip. Number 2, write down the pros and cons for each option. List as many reasons for and against each option as you can. Don't forget emotional reasons such as fear of side effects or fear of traveling away from your regular healthcare team. Number 3, give a score to each statement from 1 being not important to 5 being very important to you. Number 4, add each column and compare the results to find the higher score. Number 5, ask yourself how this meets the gut test. Number 5, ask yourself how this meets the gut test. For example, does taking the new medication or going on the trip feel right to you? If so, you probably have a decision. If not, the gut test should probably win out over the numbers. Here's an example of how any decision could be made using these decision-making steps. Example of decision to be made. Should I start this new medication? The pros total is greater than the cons. Decision result is to start the new medication. Ask the question, does this meet the gut test? Suppose that your doctor has suggested that you consider starting a new medication and you need to decide if it's something you want to do. The first thing to do is to list all the reasons for taking the new medication, the pros. These are the good things that could happen if you took this medication. In our example, it might make me feel better and it could prevent complications. Then do the same for reasons for not taking the new medication, the cons. The bad things you think might happen, such as side effects. Once you have all the pros and cons listed, score each of them by how important they are to you on a scale of 1 to 5. 1 means it's not important, and 5 means very important. After you have scored each of the reasons with a number from 1 to 5, add up the scores in each column. As you can see, the total for all the pros was 14, and the cons total was 11. The higher score shows your decision, take the new medication. However, and this is important, you then take the gut test. You ask yourself, does my gut or intuition tell me that I should take the new medication? If your answer is yes, you have your decision. But if your gut tells you no, you should probably go with your gut and your decision is no. You may also consider exploring this further with someone who is an expert. In this example, be sure to talk to your doctor about your decision. Even if your gut tells you differently than the numbers, this decision-making technique helps you with that decision as it helps you understand the reasons for your decision. This decision-making technique is an important tool in our self-management toolbox. If you have decisions that you'd like to make, you may want to include it in your action plan for this week, which we will be making at the end of the session. Introduction to physical activity and exercise. In this workshop, we will talk about physical activity and exercise for fitness and fun. People with diabetes can enjoy the health benefits and pleasures of being more physically active. We should also note that exercise is a great stress buster. Let's brainstorm. Why is physical activity or exercise important? It helps with a strong cardiovascular system, heart, lungs, and blood vessels, good muscle strength, good endurance and stamina, good flexibility, helps reduce weight or maintain a healthy weight, helps lower blood sugar, helps reduce fatigue, helps to produce good quality sleep, helps balance and coordination, reduces anxiety and depression, helps regain function, helps prevent constipation, and improves ability to participate in family and social activity. As you can see, there are many benefits from being physically active and doing exercise. A complete program of physical activity or exercise accomplishes all the things you have mentioned and includes the following types of activities and exercises. 3 kinds of physical activities and goals. Number 1, flexibility, to stretch or loosen muscles and joints, help to improve balance and coordination, and to prepare your body for other exercise or activities such as gardening, shopping, cleaning. Don't do flexibility or strengthening exercises until you have warmed up first with light endurance exercise or a warm bath or shower. Goal: 10 minutes without stopping. Do these slowly, holding each stretch for a few seconds and breathing to relax as you stretch. These can be done daily and as a warm-up for more strenuous endurance or aerobic activities. Number 2, strengthening. Makes your muscles stronger by working them harder, usually done with weight or against resistance. Also helps balance and coordination. Use lighter weights if you use them and increase your repetitions rather than the weight. Goal: 8 to 10 strengthening exercises 2 to 3 days a week. Choose 8 to 10 exercises and start with no more than 5 repetitions of each and slowly increase over 2 weeks to 10 repetitions. It's best not to do strengthening exercises every day. A day between gives your muscles and joints time to adapt and strengthen. Number 3, endurance or aerobic, also called cardiovascular exercise, such as walking, biking, swimming, dancing, which works most of the body. Goal: moderate aerobic activities, 30 to 40 minutes, most days of the week. The goal is 150 minutes per week total. When exercising at a moderate level, you should be able to talk comfortably while doing the activity. There are as many types of physical activity or exercise programs as there are people. A program can start with as little as 1 minute of activity per hour when you are awake to an hour 5 days a week. Another example is 5 minutes of slow walking, 5 minutes of brisk walking, 5 minutes of slow walking with some strengthening and flexibility exercises before and or after. When planning your program, these goals are given for maximum benefit. However, you do not need to start at this level. Start where you are now and gradually increase your activity slowly toward these suggested ultimate goals. Any increase in fitness can help a great deal. Some people with diabetes are concerned about starting exercise. They think it might bring on more problems. This, however, is not the case. In fact, it's more dangerous to not be physically active. Here are some hints for how to exercise safely. If you are feeling dizzy, disoriented, nauseated, clammy, sweaty, and or faint before or during exercise, you should not exercise or should stop exercising and eat some hard candy or raisins to raise your blood sugar. We will talk more about dealing with low blood sugar next week. Sometimes exercise can work too well and lower our blood sugar too much. Therefore, it is important to balance your meals and medication with the time you exercise. In the past weeks, you may have learned how exercise affects your blood sugar. If not, you may want to monitor before and after exercise a few times so you will know what to expect. Remember, the best time to exercise is an hour or 2 after eating. Do not exercise on an empty stomach. If you have more muscle or joint pain when you finish your physical activities than before you started, then you know you have done too much. This means you do less next time or you work at a less intense level. If you are out of breath or are so tired that you have to stop exercising before 10 minutes, then you are working too hard and should slow down. If you are concerned about certain symptoms during or after exercise and what to do about them, look on pages 101 and 296 to 297 of Living a Healthy Life for some guidelines. Also be sure to talk to your healthcare provider about these symptoms to get his or her advice on what you should do. Here are some general tips on exercise for people with diabetes. Tips for physical activity and exercise. Exercise or do physical activities about the same time every day. Coordinate exercise or physical activities with your meals. About 1 to 2 hours after eating is recommended. Do about the same amount of exercise or physical activity each time. at least 20 to 30 minutes every day. Start where you are and work up gradually. For example, if you can only do 5 minutes each time, then do it several times each day. If 10 minutes, then 3 times a day. If 15 minutes, then 2 times a day. If more than 15 minutes, then once per day. If you are already doing this much exercise or physical activity, try adding just a few more minutes or adding flexibility and strengthening exercises to your routine. Many people don't do any strengthening exercise. Your book is a good resource for helping you choose exercises. There are 3 chapters, chapters 6, 7, and 8. Making an action plan. Now it's time to make our action plans for this week. This is something we will do each week.